Ms. Tavila, could you tell us what are the latest instructions by the WHO for European countries that are still to reach the peak of the corona crisis in terms of getting back of their economic activities?
Thank you very much. I think this is a very important and very relevant question, and this is the life we are living now. We are in this situation, and we do share the concerns of the people, the concerns of the country about the impact of the lockdown caused by COVID, and the strict measures, also the impact on the economy, and not only economic consequences, but also social consequences. The impact of this virus has really affected all our lives, but I would like to mention first a very specific impact that has affected many people who have been directly infected by the virus. So I really want to give the first thoughts of my interview with you is about the sympathy that I want to express to all those who are grieving, either from a lost loved one, and also for those who are now in seriously ill situation. And I think this is also an image that we should keep in front of us when we speak about the COVID-19. I want also to send gratitude to all those healthcare workers and medical doctors and nurses who are still sitting at the front line, trying to give us the best of care in these very difficult situations, and all others who are operating now to keep us, functioning, like even those who are taking care of our electricity, of our water, and also about the delivery. Yes. I mean, these are all people that we never thought that they are essential to our lives, but they are, and I really want to thank everybody. I wanted to start like this to put this tragedy, this very, very serious outbreak into perspective of what is the cost of this outbreak. And the cost is not only economic, it's a cost of lives, a cost of health security. And it is true that this crisis has really triggered an unprecedented situation of socioeconomic impact. And we are now, I want to remind everybody, we are in a most critical month in North Macedonia, and we are expecting still to reach a peak of the epidemic in few weeks, and we remain in the midst of, they say, the eye of the storm. We are still in the eye of the storm, and several countries are also in the same situation. So we are yet to feel the full impact of this situation.
Could you tell us what are your expectations after this eye of the storm? At the end of the month, what numbers do you expect?
First of all, we cannot expect that this would be at the end of the month. Okay, there are calculations, but we never know how the virus is going to behave. We never know how the virus is going to behave when there will be relaxation of some of the stricter measures, the strict public health measures that have been taken. However, we hope that we will reach it as soon as possible, but I think it's going to be in the next few weeks. Now, the transition to a new normal is the situation. We will not transition to a complete normal business. And the instructions are that without a careful planning and in the absence of stepwise scaled up public health and clinical capacities and the premature lifting of physical distancing measures, will likely be ending in uncontrolled resurgence of the virus and bigger transmission and an amplified second wave of cases. So what WHO is saying that we need to have a phased transition from these restrictions in a manner that it will enable at the same time to regain economic situation, regain the economic capacity of the country, but at the same time, we should continue to have measures to suppress the transmission of the virus. And we can resume some part of the economic and social life, but we need also to prioritize this balance between socioeconomic benefits and also the health risks and epidemiological risks of the virus. So there are steps to be taken, and we must ensure about six conditions. And this is what the government is doing now. They are studying those conditions to see how we are going to relax the measures. It should not be a sudden relaxation because the virus can come back.
What are the first steps you suggesting to the government? What are the first steps of this combination of being very cautious and relax some parts of the life in the country?
First of all, we really need that the government gives evidence that they have controlled the transmission. So the transmission is under control. We cannot eradicate the virus. We know that we cannot, for the time being, talk about elimination or eradication. The virus will stay with us for some time. But what the government should do and the Ministry of Health should do, the epidemiological institutions should really look at the epidemiological situation and see whether we are in a controlled transmission instead of a big outburst of the infections. The second point that we tell the government is that, mind you, looking at the economic situation does not mean that you should not continue to build the capacity and ensure the capacities in the hospitals as well as in the public health institutions. Everything should remain in place to identify, to test, to trace the contacts, and also to quarantine the contacts if needed. So these actions should not be devoluted, they should be more like, intensified when we start relaxation.
What about the level of controlling the situation at the moment? Do you think it's under control? Are you satisfied?
I think considering the situation, the severity, and this is a virus that is a killer and it transmits so easily. So yes, I think that we have had a good track of actions from the Ministry of Health and the government, and they are following the guidelines of WHO in all its aspects. And if it wasn't for this, we would have seen really a health system that is unable to cope, unable to see the patients, and a lot of tragedy and death around us. But this is a controlled situation, I can assure you, also considering what is happening around us. But having said this, we should not minimize the risk of continuing transmission, and we should also look at our vulnerable people, like the elderly. What is the setup for the elderly, the homes of the elderly? We should not allow crowding. We should not allow that the preventive measures go down. We should continue on some physical distancing, on hand washing, on respiratory etiquette, and we should have learned this by now, and these have been life savings. And then the last thing I tell the Macedonians is that they need to be really in one voice. They really need to be engaged in the transition when it happens and when it will be announced stepwise by the government. If we don't support it, I think if there is one little breach of these instructions, or let us say of the measures to be taken by the government, we will have a lot of problems.
But you mentioned that the people have to follow those steps and those instructions. In the same time, there are a lot of people reacting that the measures here in Macedonia are too strict, that only the name of police hour or curfew sounds like too much, and it's not used by other European countries. Just a couple of countries do have these strict measures. What is your message to those people who think that this is too much and they cannot live with this kind of regime?
Let me tell you that if I have one message to say in this regards is that ultimately it's the behavior of each one of us that is going to determine what the virus will do and the impact of the virus. It will take perseverance and patience, and there is no fast track back into what we want to call normal, which will never be normal for some months and maybe 1 year to come. I want to tell you that those restrictive measures are taken all over the world, and I'm sorry that the translation or what is said about curfews or some restrictions of mobility is called police hours. I wouldn't call them this way, and I hope that the government and whoever is in charge will change this title. Personally, I would call them life-saving hours, because this is where we can reduce the contact from person to person and really reduce the number of people who would be amenable to show the symptoms of the disease and to need health care. Now, one thing I need to say, and please, I really would love that the people will really understand what we are dealing with here. We are dealing with the killer virus. We are dealing with the debilitating virus. The virus transmits very fast, and the virus also causes tremendous disease. It causes blocks of all the organs in a body when it attacks and when it is in a severe situation. Of course, there are mild and moderate situations, but when it is severe, it is really, really a big problem. And we are still learning how to care for it, and we are still learning what to do in order to save the patients. So it's not like I'm having a flu and it will pass. This disease is very serious, and we have to take it seriously, and the measures have to be up to the seriousness of this disease. It is a killer, remember. So this is all what I can say.
As a medical professional, may I ask you something? There are a lot of people thinking that they were naive to believe in medical science, that they can cope with such situation much quicker with medications or vaccinations. How possibly months and months there is no any answer?
It's a new virus. We are dealing with this virus for about 4 months now. It was first reported end of December from China. And I can tell you from experience and from having worked in public health for 30 years, and I'm a medical doctor myself, and I can tell you that this is the quickest science I have ever seen, and anybody have ever seen in the modern science world and in the modern history of medicine and technology. We do have the technology now, and this has allowed the acceleration of we have now about 40 vaccine trials all over the world. And we have heard yesterday from UK that they might start testing the vaccine. So it cannot be quicker than this. Usually vaccines are developed for years and years. And I do believe in science will help, but also I believe that there are other elements that should come with the science. That is, the behavior of the people and the understanding of the people, but also public health measures that we have seen. So until we get the vaccine, we have no other choice but have the public health measures as well as the medical care capacity that should be in the hospitals, and also we need to preserve and protect our medical and nursing staff so they don't get the infection themselves. And this is all what we have in hand now.
Are you an optimist that the vaccination will come in months, not in years?
I'm always an optimist. You have to be an optimist when you deal with such catastrophes, because if you don't see the light at the end of the tunnel, we might not be able to do anything. So we should be optimists, we should be perseverant, and I do think that the efforts are really heightened all over the world, and we will have solutions much sooner than any other disease. And I would like to remind everybody about the vaccines. And we have heard recently a lot of people putting in question, what is the value of vaccines? Well, I can say that now we have a very good, solid experience and solid example of how much vaccines are life-saving. People have forgot about smallpox. They forgot that measles also can kill. And we should go back to our beliefs that when we have a solution such as vaccine, we really need to use it. And I hope all those that are talking about anti-vaccination will understand, and other people following them will understand how important vaccination is. And for the occasion, I would like to ask all the parents to continue to vaccinate their children with the regular vaccine, and to continue on the schedule of vaccinating them even through this COVID. And this is really life-saving as well. We do not want to end up with a measles epidemic at the same time that we have a COVID epidemic. So please take care and follow the vaccination for the children and the adults.
Do you have a wider picture of the situation related to COVID in the Balkan countries? Can you tell us which country reacted first or in best manner, or which country was dragging its legs? Because the figures, the data is pretty different.
It's very difficult to compare countries, to tell you the truth. And I know that all of the Balkan countries have taken measures early on, and it was even before the situation has really increased in those countries. It was when the China cases started to arrive. The measures that people see are the strict, restrictive measures, but the medical and public health measures have started much earlier in preparing the virology labs, in preparing public health actions, protocols of actions, and also preparing the health system. So I think all of them have reacted nicely and on time, but we need to remember that many factors and conditions in countries are different. And for example, countries with younger population will behave and react differently than countries with older populations. And also the speed of the disease might explode in one situation and not in another. For example, if you have a lot of touristic attractions, like what has happened in Italy or Spain, or if you have a lot of conferences happening in the same time, this will cause an explosion. We call them amplificator events. They will cause explosion of the transmission. So. And also it's very important to understand that what we are seeing is different ways of testing. So the numbers themselves have to be interpreted within the context of the country. So some countries would test everybody, the mild, the moderate, and the most severe. Other countries, like in Macedonia, will focus very specifically on the moderate and the severe and the symptomatic cases. So it is very difficult to compare countries, and we will need later on some research to be able to see, and also to have some, explanations, lessons learned, evaluation of the responses all through those countries.
On the global level, there were a lot of critics towards HW organization. Some of them say that you acted late, that the measures at the beginning could have been more stricter, more loud, from the very beginning of the crisis in Europe, specifically because after China, Europe became the most affected area. So what could be the consequences of, let's say, seizure of the money from US government, or as a decision of President Trump?
Let me start by the end. There are many reasons for the decision of President Trump, and I don't think this is the right place to discuss them. But what is important is that to really ascertain that United States has been very generous with WHO and is one of the most contributors to our budget. And not even that, we have members, we have citizens from United States who are members of our staff. We have at least 30 also staff in Geneva working on, from CDC, Atlanta, working on the issues of COVID-19 specifically, and they have been contributors for polio eradication, for elimination of diseases, etc. So it is a decision. Probably there are some reasons for this, but from our end, the way we see it is that WHO will be evaluated after this crisis, and we do this evaluation after each crisis. However, during the crisis, we should really avoid this type of blame and shame, and it was done very early, even as early as 4th January. China has declared on 30 December that they have a problem, and 4th January, the WHO communication has started alerting everybody. Our Director General, Dr. Tedros, has said very clearly that this is an unprecedented situation. This virus is a killer, and all the countries and the governments have to take responsibilities of taking care of their own population and citizens.
Mr. Villa, HWO almost every day appeals, every day is asking solidarity of the world. Do you think that all the countries are fair in this situation? Do they play fairly? Are all of them sincere, openly giving the information that are very, very necessary? Were the countries like China and Russia sincere and fair at the very beginning of the crisis in their countries with the numbers? At the moment, there are a lot of doubts that the numbers were correct coming from China and from Russia.
Frankly speaking, I'm not working in those countries, but I do read a lot. From what I read and from what I have seen, is that both China and Russia have come out saying that we have a big problem. Even President Putin has said that. So, and I just want to say that there has been enough of guidelines and also alerts by WHO itself that we do have big problems. And this is the message that every country should listen to and hear, and not look what the other countries have said, or is it 1,000 plus, 1,000 minus. I don't think it will make much difference, because at the end of the day, we are not testing the same groups of people. The testing is different, so the numbers can be different. Recently, China has revised their numbers, and their numbers sometimes were missed in the middle of the outbreak. So it's very difficult to ask public health or to ask medical doctors at the same time to give the necessary care and the necessary protection, and at the same time ask them to note every single case that they have. So China, after the situation calmed down, they have done a review of their epidemiological situation, a review of all the cases that have died during that period, and they have added 50% to their numbers overnight. Mm-hmm. So yes, the numbers might not be very relevant, but not only whether it is the will of a government or not, because of the nature of the disease itself, because some mild cases also can go unnoticed. So we are dealing in a very particular unheard situation. We are learning, and we will learn more after this really subsides and calms down.
We hear more oftenly that we should live with this virus for some time. In your perception, how the life will look like with COVID-19 in the coming months?
Yeah. I don't think we will have a normal, like the normal that we know. There will be something new. But the most things I cannot predict really, but I can see my behavior changing. I'm sitting here working from home most of the time. I try not to mingle and not to go outside. I don't go to crowded areas. So even and this is to protect myself, but of course to avoid being the little chain, to avoid supporting the chain of transmission. So this is one behavior during the crisis. After the crisis, there should be some moment for readaptation of in our usual life. And I hope that we have learned a lot of lessons from this. And I hope that we have learned that we cannot, for example, make a straight line separation between security, health, and economic development. All these are interlinked. So health is at the heart of security. We have seen that the governments with this big issue have even got the army on board, and the army is helping in building hospitals. So even the concept of security, health and development and economic growth have really changed. We have seen that ill health or a problem in health, when we are not really well prepared, or when the hospitals have been understaffed and also underfunded, they are going to be overwhelmed by one little virus at a time, and everything crumbles around that. So we have to learn from these, and health is about country security and human security, and ill health can really shut down a whole of society, a whole of life, and the whole of life as we know it. Having said this, there are positive issues to that. One thing that we have seen is that the people are really have shown solidarity and they have displayed unity. Of course, we have some people who would like to wander around outside in the time of curfew, but still the majority of the people are listening to the instructions and trying to protect themselves and others. And I hope that this solidarity and unity will continue because we have learned it the hard way.